Hi everyone. Today lecture would be about infection control in dental office during COVID-19 crisis. My name is Al-Marashi. I have an MSc in oral and maxillofacial surgery from Manchester. Today we'll have a walk around the clinic, starting from the time before the patients arrive to our clinic, and then when the patients arrive in the reception, and finally within the clinical area. We'll also have short notes about if we have shortage in the PPE, personal protection equipment. So what would be our crisis plan? So starting from before the patients arrive, as we said, and then when the patients enters our reception, and finally when the patient enters the clinical area where the treatment deliver. Within the first stage, there are a few things we need to consider. The first thing would be examination of the staff. We also need to consider triaging our patients, and also we need to screen the patients for respiratory illness by telephone. Regarding the examination of the staff, this should be done before we accepting patients. This would include fever and respiratory symptoms. We need to check the body temperature for our staff members. We also need to inquire and examine for any respiratory symptoms. These should be done on a daily basis. If the patient or our staff is suspected to have any of these fevers or respiratory symptoms like coughs and shortness of breath, they should be allowed to be given a sick leave. We need also to consider triaging our patients. This need to be done to establish the patients who need any urgent dental care, and also we need to set our priorities, so the most urgent treatment need to be delivered before the less urgent one. So priority need to be set after we establish the patients that need dental care, emergency dental care. We need also to telephone screen all the patients that is found to have urgent dental care for respiratory illness. We need to ask specifically if they have fever, if they have cough or shortness of breath. If the patient is found to have any of these, any emergency treatment should be delayed until the patients have been cleared from the respiratory infection. This is before the patient even arrive to our reception. When patients present to our clinic for an urgent dental care, there are few things need to be considered at the reception. The first group of things are related to the reception floor, furnitures and items. The second group would be related to the patient themselves. In relation to the reception floor, furniture and items, there should be an adequate separation between a patient. Adequate separation can be either by a spaced seating area, a limited spaced seating area with at least 2 meters between each seating area, or by giving an timed appointment. For example, we give an hourly based treatment, so the reception will be empty at every time. We need also to consider removing all the non-essentials items from the receptions. Non-essential items, for example, like books and magazines, need to be removed. This can be considered as a source for contamination and might carry the risk for infection from one patient to another. Disposable tissues should be available and should be given to the patients. Staff also need to observe the respiratory hygiene practiced by the patient. For example, if the patient coughs or sneezes, they should cover their mouth with their arms or use the disposable tissue that have been provided by the clinic. Cleaning also needs to be considered, and at this time during COVID-19, it should be done more often. Floor should be cleaned at least twice daily, and should be done by either using a hospital grade disinfectant with a varicidal properties against COVID-19, or by a mixture with sodium hypochlorite and water. The mixture of sodium hypochlorite and water is different. The NHS recommends about 25 milliliters for each 1 liter of water preparation, while the local recommendation is about 100 milliliter for the preparation of 1 liter of this mixture. This mixture, as we said, need to be used for cleaning and disinfecting the floor at least twice daily. All horizontal surfaces like tables also should be cleaned with this disinfectant solution. Vertical surfaces, on the other hand, like walls or curtains, don't need to be decontaminated this often unless they are obviously contaminated. We need to minimize the contamination of the cleaning solution and the cleaning tools. For example, if we have disposable clothes, it should be used, or if we are using a reusable cloth for the disinfection purpose, it should be cleaned and disinfected and then left to be dried before being reused. This is about the cleaning of the reception area. What about the patients that present to the reception? What do we need to consider doing for them? Body temperature needs to be checked for each patient before they enter the reception. Any patients who have hyperthermia or fever above 38 degrees centigrade should be dismissed from the clinical area, and they are best to be referred for physician. No escort at any time should be allowed unless it is absolutely necessary. For example, if we have pediatric patients that need an escort with them, then we might allow one of their parents to present for the dental care with them. Surgical mask in the reception should be worn by the patient, and if the patient doesn't wear a surgical mask, this should be given by the staff to the patient to cover their mouth and nose, if the stock is permitted. Hand hygiene should be practiced by the patient by alcohol rub, and we will discuss later on in this presentation about the use of alcohol rub and hand washing and how the steps should be done to cover the most surfaces of the hand. If the patient present in the clinic, then we ask them to wait outside until the time of their appointments happened. This is the consideration at the reception area. Finally would be when the patient entered into the clinical area where our treatment is delivered. There are a few things also need to be considered. These can be either related to the staff members or regarding the cleaning of disinfection of the clinical area. Things to be considered by the staff when patients are present within the clinical area are including the personal protection equipment, which is the most important thing during this time, including the gloves, gowns, surgical gowns, the eye protection, and the respirators in form of N95 as the recommendation of the CDC, or the FFP3 as recommended by the NHS. Surgical mask sometimes can be used either alone or in combination of respirators. Regarding the eye protection can be either in the form of a goggles that covers the side of the face as well, or a full face shield. Respirators, on the other hand, as we said, either by the recommendation of the CDC N95, which has the efficacy to filter about 95% of particles within the air, or the FFP3, which is recommended by the NHS. This can have a filtration efficacy of 99%. For the treatment that we anticipate aerosol protection, the personal protection equipment should include a full face shield and a respirator. If we don't have a respirator, only surgical mask is available, then we should avoid any aerosol generating procedure, and the surgical mask should be used in combination with a full face shield. If you don't have a surgical mask, a proper surgical mask available, then no treatment can be done during this period. Hand hygiene should be practiced by the staff, including the dentist and the dental assistant as well. This can be done by water and soap or alcohol gel, and done before entering the patient to the clinical area, after treating the patients, and also after handling the personal protection equipment. We need to avoid aerosol generating equipment. As you can see here below, the high-speed dental handpiece, the ultrasonic scaler, and also the straight surgical handpiece. All of these equipments are proven to generate aerosols and should be avoided at this period. We need to implement a risk reduction protocol. A risk reduction protocol during this period is done by avoiding using these instruments, and as well as by the use of, for example, of rubber dam in combination with a high volume suction. This all will minimize the aerosol that is generated during the treatment. Thorough history taking need to be taken from the patient. We should specifically ask about any present respiratory diseases. We need also to take history from the patient if they have contact with patients who have COVID-19. If the patients have a history of contact with COVID-19, if the patient have current respiratory illness, then no treatment, whatever of kind, should be delivered. The door of the clinical area need to be closed during the treatment to avoid the aerosol that is generated during the treatment to contaminate the services outside the clinical area, like the reception. These would be the things that have been considered by the staff. And now, what do we need to do to maintain high level of disinfection within the clinical area? All the floors of the clinical area and horizontal surfaces like the countertops, tables, should be cleaned and disinfected after every patient. And this can be done by the same mixture of disinfectant solution we have said, sodium hypochlorite and water, or a hospital grade disinfectant to be used. But this time it need to be used after every single patient. If the treatment included an aerosol generating procedure, then we should leave the area for at least 20 minutes if it is in a negative pressure. If we have evacuation of the evacuation device within the treatment area. And if it is in a neutral pressure, like most dental offices, it should be left for at least 1 hour with the window open before we carry out the disinfection. This will allow the aerosol and the droplets to settle down on the surface to be disinfected then. Devices and equipments and any contact surfaces around the patient for about 2 meters need to be either wiped with a disinfectant, as you can see here, using a wipes, or disinfected using a spray, or we can cover it by disposable plastic sleeves. Here you can see the picture of the handle of the tray being covered by a plastic sleeve. This is the 3-way syringe being covered by a plastic sleeve with a disposable tip on it. Also, the handle of the light, it is a possible contact surface and should be disinfected or covered with a disposable cover. The radiographic devices, also the computers within the clinical area, all need to be disinfected because these are a possible contact surface. We might carry the infection from these devices to the patients, or sometimes contamination can carry infection to ourselves or to the staff member. Now, after we finish from the clinical area, now what are the steps we need to consider to follow during the hand hygiene practice? Hand hygiene practice, as we said, can be done by alcohol rub or by using a mixture of water and soap. Hand hygiene, as recommended by the National Health Services of UK, NHS, should be include these 7 steps, starting from this picture, and ending with this one. 7 steps would include rubbing the hand palm to palm to clean the palm of the hands. Then we rub the palm of the hand with the back of the other hand and in between the fingers. Following this, we need to also include the back of the hand of the other finger. We also need to do the cleaning of the hands palm to palm and in between our fingers. Finger interlocking to clean the nail beds by rubbing the nail beds and the back of the fingers with the palm of the other hands. And this should be done for each hand. We also need to clean the base of the thumb by circular motion and rotation to rub the finger and the base of the thumb. This should also done for each thumb. Circular motion to clean our fingertips by rubbing the fingertips with the palm of the hand. And finally, we need to wash our wrists. It's important to take out any jewelry. For example, if you have bands, watches, bracelets, anything that covers part of your wrist, it should be removed to allow proper disinfection of this area. If you have a wedding ring that have a jewelry on it, it might break the gloves and it is difficult to be disinfected. So it's better to take off wedding rings. After we finish this, if we use soap and water, then we need to wash our hands with water, close the tap with using the elbow or a tissue. Then we use a disposable tissue to dry our hands. This takes about from 15 seconds to about 30 seconds with a 20 seconds on average to perform these steps. If we use an alcohol rub, then we can do these steps and repeat it until the alcohol dries. This would be about the hand washing. The final set of slides would be about crisis planning for personal protection equipment. If we are in a low stock or we are out of stock of the personal protection equipment, the surgical mask, the respirators, or the eye protection, what can we do? Ideally, when the stock permits of the personal protection equipment, respirators are intended for a single patient use and should be disposed after each treatment. Reusable eye protection must be disinfected prior for being reused for another patient. If it is a disposable eye protection, then it needs to be taken off and disposed. We need to consider changing the gown after each patient and sometimes within the same treatment session if it is broken or obviously being contaminated. We also need to consider removing all the personal protection equipment if we intend to leave the clinical area. These are the things we need to consider in ideal situation when the stock within the local market permits doing this. But what if the stock is limited? What if we have out of stock? We can't buy any more personal protection equipment. What can we do? In regard for the eye protection, you need to consider now non-urgent treatment should be considered to be cancelled if you haven't done so at this stage. We need to consider implementing an extended use of eye protection. Extended use meaning using the eye protection by the same healthcare practitioner for more than one patient. But this has some cautions because this might have put the healthcare member at a risk for cross-infection, sometimes might carry an infection from one patient to another or from the patient to other staff member. Considering the use of the extended eye protection should be dedicated for a same member of staff. So we can't use an eye protection that have been used by another staff member. We also need to disinfect and clean the eye protection between each patients. Starting by using a hospital grade disinfectant that with a virucidal property, we need to start to disinfect the eye protection from the inner side and then from the outside. We leave them to dry before being reused. What if the face mask is in low stock? We need also to remove the use of face masks that we provided for the patient in the reception. We need to implement an extended use of the face mask for multiple patients. So, for example, if we are wearing a specific mask, we should never touch it, okay? We should never adjust it, okay? And then we use a multiple session with the same face mask. But if it is become wet or obviously contaminated, it should be disposed. If the integrity of the nasal bridge components or the loops have been broken, it should be also disposed. The type of mask that should be used during this period, and that is suitable for an extended use, it should be a water-resistant face mask with elastic loops, a tie-on face mask. Okay, this might become loose during the treatment, and sometimes it's become broken when we try to adjust it. So it's better to use an elastic loops during this period. Homemade masks sometimes are locally produced masks, sometimes are available, but it shouldn't be used during this period because in most instances homemade masks and locally produced masks are not water resistant, and if it have been used as a last resort, homemade mask should be used in a combination with a full face shield for a non-aerosol generating procedure, and it should be never used for an aerosol generating procedure. Crisis planning for the respirator. So if we are in shortage of the respirators, what can we do if the stock is limited? And one way to do an extended reuse of respirators is by dedicating a number of respirators for each staff members. For example, if we work on a weekly basis for 5 days for a week, we might take off the respirator, place it in a paper bag to be used on the next week. For example, if we use it on a Sunday, we can use it on the next Sunday. This about 7 days period will extend beyond what we believe the period of time that the virus can live on the external surface of the respirators. When we reuse the respirator, we consider it as infectious. We should never contaminate the inner side of the respirator, and we should have a hand hygiene prior to handling the PPE, using a fresh gloves to place the respirator on ourselves, and then we need to take the gloves, perform hand hygiene before entering the clinical area. We might also consider shielding the respirator. Shielding the respirator can be done by using the respirator with a water resistance face mask on the top of it. This will prevent the contamination of the external surface of the respirator with blood splashes or droplets that is formed during the treatment. If we have a respirator like this one that have been contaminated from external surfaces, it should be disposed. We need to perform user seal check after each reuse and after the use of new respirator or a used one. A user seal check will ensure that the adaptation of the respirator on our faces. We need to follow either the manufacturer about the user seal check, or in a general talking, we need to place both hands on the external surface of the respirator, and then we give a positive and negative pressure. If there is any leakage of air beneath our eyes or on the side of the face, okay, that means that is not perfectly adapted on our face. If the respirator is perfectly adapted, during the user seal check, we notice that the face pads on the sides of the respirator is moving during each respiration cycle. We need to consider avoiding disinfecting or sterilization of the respirator. For example, the use of autoclave dry heat, or the use of sodium hypochlorite and water mixture or alcohol. All of these have been found to affect the efficacy of the filtering capacity of the respirators. We also need to check the respirator straps and the nasal bridging components and the respirator in whole. If there is any sign of damage or obvious contamination, it should be disposed. These are useful links that I have found on YouTube regarding the reuse or the limited reuse of N95 respirators. We also need to know how to perform a user seal check. You can follow these links and have a look about this video, which I think is very important during this time. This is the crisis plan during COVID-19 for the personal protection equipment. Finally, we have a few recommendations. General recommendation: we need to postpone all the elective dental care treatment now and only consider giving an emergency treatment. We also need to postpone non-urgent dental examination. We should use the highest available personal protection equipment. We need to maintain high level of infection control in the dental office because the virus is found to live on the external surface for a considerable period of time, for days, and it can live within the generated aerosol during the treatment for hours, and this will carry the risk of infection. We need sometimes to consider the limited reuse of the personal protection equipment, but this has its own drawbacks, as this might cause a risk of infection. Non-steroidals, anti-inflammatory drugs, and COVID-19 period, ibuprofen have been found sometimes without any scientific evidence to aggravate the signs and symptoms of COVID-19. So it's best to avoid the use of ibuprofen during this period. Paracetamol for patients with suspected COVID-19 or having a respiratory infection in general, it's best to advise them to use paracetamol instead, as it is a safe alternative. Finally, these are the references that I have used for this lecture, from the CDC website and from the NHS website. You can follow them to have more detailed about the things that we have just discussed. If you have any question, I'll be more than happy to answer. This is my email and also my Facebook page. Thank you very much.